So I would request Dr. RISHI SWARUP as our first speaker to tell us something about sustained hydration, hydrate to heal. And this is a sponsored talk, and we have the Alcon supporting us this very important program. Thanks to Alcon, we have this program here today, and Rishi is going to tell us about sustained hydration and the insights about this new molecule that has come up. Dr. Rishi, please.
Am I audible?
Yes, Rishi.
Yeah. Thank you, Dr. Partha. I'd like to thank the AIO Scientific Committee and Alcon for giving me this opportunity. I'm very happy to talk on this particular topic because it's connected to something which all of us deal with in our clinics, which is essentially dry eye. And most of our post-operative unhappy patients are also, if we think about it, the source of unhappiness is often the dryness. And this new drop, which has been launched by Alcon, is, I think, a fabulous answer to many of these patients. And I'll just spend the next 10 minutes trying to make a case for these. I'd like to state that this slide deck is prepared by Alcon, and I'll be presenting it to you on their behalf. So dry eye is common. We all know it. Everybody who's seeing patients in the clinic knows that we are dealing with dry eye patients, and especially after cataract surgery, post-operative dry eye is a very, very big problem. And I'm sure all of us acknowledge that. If you look at this slide, you'll notice that especially when you're dealing with older patients after cataract surgery, as the age increases, the prevalence of dryness after cataract surgery significantly goes up. And this is, of course, attributable to many factors, especially age-related dryness is already there in this subpopulation, and they are prone to developing post-cataract dryness immediately after surgery, which can persist for quite a long time. But it's not just the older population, it's also the younger people who are having refractive surgeries. We know one of the main problems after refractive surgery is dry eye. And again, that is attributable to a number of factors, which I shall be coming to in my subsequent slides. Up to 95% of patients having corneal refractive surgery can have some element of dryness. And studies have shown that it can take up to 3 months for this dryness to go away, especially after cataract surgery, and after refractive surgery, it could be even longer. So by and large, it's at about 1 month, almost 60% will still have some element of dryness. And immediately after surgery, almost all patients have some symptoms or signs related to dryness. So why do we get dryness after LASIK and cataract surgery? What are the factors? It's essentially a combination of these 4 factors. A desiccation, which is basically lack of tears, damage to the surface epithelium essentially, a reduced tear film breakup time, which basically allows for the tears to again, the tear film to be destabilized. And of course, there's mechanical friction. And it's a combination of all these factors, and also probably an element of surface inflammation, which leads to post-operative dryness in most of these situations. Also, in post-LASIK, I think there's also an element of neurological loss also, which is playing a factor, which again leads to one of these, and we'll touch upon that in the subsequent slides. So let's touch upon all these 4 factors one by one. Desiccation. In LASIK, we know that there are multiple things, multiple factors which have been implicated. One is that you're making a microkeratome or a femtosecond cut, and you're disrupting the subepithelial plexus of nerves. And that in turn will lead to reduced corneal sensitivity. And because you're having that feedback loop getting affected, you'll blink less. And also the nerve supply to the meibomian glands may be affected. And both of these can result in an increased tear evaporation, resulting in an evaporative dry eye. Goblet cells can get damaged, especially when you're doing a microkeratome or you're applying the suction of your femtosecond laser, and that can damage the goblet cells, can result in reduced mucin production. And mucin has a very, very important role in tear film stability and lubrication. That again can result in dry eye. And because you're flattening the cornea, you're altering the shape and distribution of tears, and that can result by itself in reduced stability of the tear film, and that can result in dry spots, and that again contributes to dry eye. So all these factors are important in post-corneal refractive surgery dry eye. So what happens is you have a reduction of the tear film breakup time, but also there's a reduction in Schirmer's values immediately after surgery and increase in the tear osmolarity. We all know that in the pathogenesis of dry eye, it's all these factors come into play. And post-refractive surgery, it can take up to 6 months for this dryness to go away. And it's important that when we are counseling our patients for refractive surgery, we must warn them about dryness, because this does happen in a lot of them, and it can take a few months for their eyes to come back to normal. Cataract surgery, what happens? This was about LASIK. What happens in cataract surgery? The intervention is essentially you're creating an incision. So again, you're cutting the cornea, you're damaging corneal nerves, you're creating a break in the surface. And both of these actions can also trigger inflammatory pathways. And all these things can contribute to your dryness. You can have disruption in the tear film stability because of the irregularities created and the inflammation in the tears, inflammatory markers which are reduced, which are liberated into the tears. And the nerve damage itself can cause reduced corneal sensations, disruption in the lacrimal loop, and that can again result in reduced tear production. So that's about desiccation, epithelial damage. We do know that the epithelial staining does go up after LASIK, and that can sometimes last up to 6 months or even 12 months. Why does it happen? It can be because of, in cataract surgery, it can be because of impaired epithelial wound healing, increased epithelial permeability, decreased epithelial metabolic activity, and loss of the cytoskeletal structures in the epithelial cells. Studies have shown that the location of the wound and the size of the wound both can play a role, and this could possibly be related to the points of entry of the corneal nerves at the limbus, and also your depth of the wound, the configuration of the wound, whether it's a single planar or a biplanar, all of these factors could play a role in the postoperative dry eye. Studies have shown that the epithelial thickness immediately after surgery can increase, and then it slowly reduces over the next few days. Even the corneal stromal thickness also increases and then comes back to baseline over the next couple of weeks. So I feel that this could be more to do with the endothelium rather than the epithelium, but it does affect the epithelium. And because of that, you can have the surface getting affected, the tear surfacing could get affected because of that. There could be irregularities which can again manifest as dryness. We all know that tear film breakup does reduce after any surgical intervention in the eye. And my personal take on this is that it could be because of two factors. One is the inflammation from the surgery itself, and the drops that we are using. A lot of the drops contain preservatives, and we're doing a lot of frequent dosing, and that can affect the meibomian secretion and could also end up blocking the meibomian orifice. And that probably is one of the reasons why we have tear film breakup time going down. Again, we know that the nerves getting cut can also reduce the blink rate, and all of those factors come into play. Damage to goblet cells, we discussed these factors earlier. So this is just to show that the tear film does go down significantly after LASIK. And the good news is that it does recover. Schirmer's also gets affected. And this is a study which showed that at 1 week, there was a drop in different age groups. And you can see the drop is more in the older age groups. But the good news is by 3 months, most of these do come back to baseline. So it's important that we do recognize that it's not just that there's an element of evaporative, there's also an aqueous component getting reduced. And both of these can contribute to post-operative dry eye. Finally, coming to the one that really causes the most pain, friction. And essentially friction is because you have a reduction in the goblet cell density and reduction in your mucin. And mucin is an important part of the tear film, which not just stabilizes the tear film, but also gives a lot of lubrication. And the fact that it is not there is certainly going to cause a lot of friction, mechanical friction, which will incite the inflammatory process and triggers that inflammatory cascade, which perpetuates the post-operative dry eye. The impact of dry eye, yes, dryness is there, but if it's not causing an impact, it's perfectly fine. But I'm sure all of us have seen these patients who are absolutely doing beautiful after surgery. The vision is 6/6, whether you've done a cataract or a LASIK. Even the cornea appears to be glistening, but chub raha hai. They're telling you that they're uncomfortable, they're complaining of watering, and they have a foreign body sensation. And those are the patients who really distress us, because you've done a beautiful surgery. They should be happy, but they are not happy. And it really impacts not just the quality of their eye, but also the quality of their life. And it's certainly an unhappy outcome for both the patient and the doctor. And it's because of all these factors. So, and this has been quantified by various questionnaires, the OSDI, VF14, SHAI, and there is no doubting that the scores definitely get affected, and there is a genuine problem of post-operative dry eye, which does need to be addressed. And I think this is where this particular solution offered by Alcon comes into play, which is the sustained hydration. And they have proposed this concept of HEAL, which is hydration, epithelial regeneration, augmented protection, and lubrication. And essentially they're impacting these 4 factors which lead to postoperative dry eye. So desiccation is kind of tackled by hydrating, epithelial damage by promoting epithelial regeneration, the shortened tear film breakup time and tear film instability by augmented protection, and the final concept of friction is being impacted by lubrication. So what is it that sustained hydration has, which is unique? It's a combination of HP guar, sodium hyaluronate, boric acid, and the polyethylene glycol, which was already there in their Systane Ultra. So the real addition is the sodium hyaluronate, which along with the polyethylene glycol, which is already there, is certainly improving the formulation significantly. We all know sodium hyaluronate has this coil-like structure, which increases its shear thinning property, and it attaches to damaged corneal epithelium, which basically increases its retention on the ocular surface. It's a natural occurring hydrophilic polymer. And HP guar has already been there with the Systane Ultra family. And we know that it's a viscous gelling agent which binds to the corneal microvilli, and kind of it acts like what mucin does to the eye. It's a mucomimetic, and it stabilizes the tear film in many ways, and it increases the retention time of the lubricant on the eye by itself. So these 2 are the main key elements which have been added and which really add a lot of value to this particular formulation of sustained hydration. We know that sodium hyaluronate binds to the ocular surface and traps 1,000 times its weight of water. So it significantly adds a lot more water to the surface, and that is how it hydrates the surface, the first concept of hydration. And mucomimetic reduces the friction. So this unique combination of HEAL is what really heals the postoperative dryness that we encounter, and which is such a bugbear for all our patients. So How does it hydrate? It traps 1,000 times its weight in water, thus providing a lot more water to the surface. And that's the real aqueous component is replenished in this particular way. And HP Goa retains that water on the surface also, and that again helps a lot. And studies have shown that hydration protection against desiccation before and after treatment makes a huge difference. Epithelial regeneration, sodium hyaluronate, several studies have shown that it aids epithelial regeneration, and epithelialization time is enhanced with sodium hyaluronate. And so as a molecule, it's probably one of the superior molecules, and that is why most of us have now shifted to sodium hyaluronate. And this wonderful combination with polyethylene glycol, I think, is working really well. And that's the unique selling proposition in sustained hydration. It gives a wonderful combination which aids the epithelial regeneration very beautifully. And the time to epithelialization is significantly improved, as has been shown in several studies. Augmented protection is essentially they are enhancing the tear film stability because of essentially the HP Goa, which acts like a mucomimetic. So it increases the tear film stability and increases the breakup time. And because the breakup time is increased, the tears stay on the ocular surface for longer. And essentially, your evaporative dry eye component is tackled by that particular way. And this has been amply documented by several studies, including this one. HP Goa, I think enough has been said in the past as well. It has viscoelastic properties and shear thinning properties of sodium hyaluronate along with HP Goa. I think both provide augmented protection to the tear film, which significantly enhances its stability much more than what we were getting with Sustain Ultra. And this has been shown very nicely. You can see the curve showing post-treatment significantly improving with this particular combination. So to conclude, dry eye is a problem after both LASIK and cataract surgery, which are essentially the most common surgeries that we do. And it does impact the patient satisfaction. We all know that. And this combination of ingredients which is present in sustained hydration helps to hydrate, helps to regenerate the epithelium, augment protection to the tear film, improving its stability, and lubricate the eye, thereby reducing friction. I think it's a good molecule that Alcon has brought to the Indian market, and they have priced it almost similarly to their previous molecule of Sustain Ultra. And I personally have used it in my own eyes, and a lot of my patients, I've moved them over to Sustain Hydration, and I can see that the patients are loving it, and they're happy that it has come to the Indian market. And I hope in the future iterations, they are even able to come with the preservative-free formulation, which will increase the value much further. Thank you.
Thank you very much, Rishi. And we'll have short comments from Dr. Namrata about sustained hydration, and then we'll move over to our presentations for the day.
Thank you, Dr. Partha. I think it was a very nice presentation, Rishi. And with all the presentations and all the studies, there's a lot of meta-analysis also, which have been published, evaluating the role of sodium hyaluronate in case of dry eye. And there are two, in fact, which contradict each other. One of them says that sodium hyaluronate doesn't have any effect. There are about 18 studies in that, and the other says that it has effect. I think what we need to break down is we need to see whether it has effect in dry eye or not, post-cataract surgery dry eye, which is going to be a different category, post-LASIK dry eye, which is going to be yet another category, and dry eye due to systemic diseases, which is again going to be yet another category. So I don't think it has been studied that extensively in details. We don't seem to find any publication or any randomized study of this combination of both, HPQR and sodium hyaluronic acid, although isolated, both of them are available. So it remains to be seen how it is, but I'm sure it promises to be a great drug. And let's hope that in future we are able to ascertain in which conditions it is going to benefit. Having said this, in the patients that we have prescribed, it causes it's thicker, it's more viscous than the Systane Ultra that we had or other lubricants. So it kind of does, it's not that liquid. So that is one flip side of it. But of course, in severe dry eye patients, it is going to help. I think for every publication that is there, one thing is very important that you have to look at, and that is if there is any conflict of interest or financial interest or not, because that will, skew the conclusion uh, towards towards it, or away from it. But I think we do need to do long-term studies and in various indications, very nicely highlighted and presented, Rishi, like always.
Thank you. I'd like to add that even though it's viscous, it doesn't really cause blurring of vision. So it kind of does the job without the adverse effects of its viscosity. So the Systane gel drop, which is also there, it does cause some blurring for a few moments. But this one, I found that it actually feels very nice in the eye, and patients seem to have loved it when I've moved them over from older formulations.
So it's a difficult proposition. The companies will say, now we've come with Systane hydration. Now, what do you do with Systane Ultra, that the patients that you had been giving, or what do you do with Systane gel that you have been given? Likewise, it's very difficult to shift a patient from one drug to the same drug of the same company. It's not an easy task. So how do you tell them, now you stop this and now you start buying this? So it's like that.
Thank you very much.